Kia ora and welcome to today's podcast. I'm Monique Bradley. Diabetes is a complex condition that affects many parts of a person's body. The good news is that with good support and a plan of action, there is a lot you can do to live a healthy life and prevent potential complications. Today we're going to learn more about these complications and how to prevent them. In today's episode, we are joined by two healthcare professionals who know a thing or two about supporting people with diabetes and helping to prevent the complications that can happen to someone with diabetes. We will also cover more about the circle of care that surrounds and supports someone living with diabetes to stay well. So it's time to meet today's important guests. First up, Dr. Brian Betty. He's a specialist GP in Porirua and the current medical director of the Royal College of GPs. He's been a part of and contributed to all levels of the health system in Aotearoa. Last year, he was made an Officer of the New Zealand Order of Merit. He's a strong advocate for equity and access to quality healthcare for everyone, which can be demonstrated through his work advocating for improvements to New Zealand's high rate of type 2 diabetes. Kia ora, Brian.
Kia ora.
Lovely to have you. Thank you for joining us. Also on today's episode, we have Liz Dutton. Now, Liz works at Diabetes New Zealand's head office in Wellington as Service Development Manager and is a former clinical nurse specialist in diabetes. Liz has a keen interest in diabetes self-management education programs and is part of the team rolling out these programs through various Diabetes New Zealand branches. Kia ora and welcome to you as well, Liz. Liz, we're just going to get you to unmute your microphone. Kia ora and welcome to you, Liz.
Kia ora. Thank you very much for inviting me today.
Lovely to have you with us. So we are going to dive straight into today's questions. This is a big episode because having lived experience with diabetes as well, often we forget about the importance of self-management and self-care, especially when people are stressed or have very complex and complicated lives. We also know too that people living with diabetes make so many decisions throughout the day about their well-being. So we are in the hands of absolute experts today to help talk through those self-care plans. So Brian, first of all, I know that you've been working tirelessly over many years to improve equitable health outcomes for all New Zealanders. Does where we live in New Zealand currently make a difference to the health care we receive? That's a big question.
Look, it is a big question, and it's a really, really important question in New Zealand. The answer is yes, it does make a difference. So what we tend to see in those areas of deprivation perhaps or high need, and I'm sort of thinking of parts of South Auckland, East Porirua where I live, Northland, certain rural areas that may have high Māori and Pacific populations, we tend to see higher rates of diabetes, in fact, substantially higher. So it can be 2 to 3 times the national rate. So for instance, where I work in Cannons Creek in East Porirua, our practice size is about 7,000 patients come to see us. We're 90% high needs, but our rate of diabetes is 3 times the national average.
Wow.
So that means that differentially, there's more burden from diabetes in these areas. There's often more stress on the service providers that are trying to provide care for those communities. And actually that can lead to issues with inequitable outcomes. Now we know there's a lot of reasons why we get inequitable outcomes in terms of health outcomes and what actually happens. But there's no doubt where we sort of get concentrations of high rates of diabetes amongst people living in certain areas, that does affect outcomes and what actually happens. So, yeah, this is an absolute reality in New Zealand.
Look, this is the first time I'm actually hearing, I didn't realise those with the numbers. This is a first for me, and I really want to know, is there an understanding why those numbers are higher in those areas? And this is, again, I've gone off my notes today because I want to know why. Is there data around that?
Well, look, we do know the rates are different. So for Māori Pacific, the rates are 2 to 3 times higher, Pākehā in New Zealand, in Aotearoa. So, the reasons for that, I mean, look, that is associated with deprivation. There's no doubt about that. It's associated with people living in poverty. There's no doubt about that. It's associated with obesity or higher weight. We know that weight is related to diabetes and the development of type 2 in particular, not necessarily type 1. So we know that these factors all combine. There may be genetic factors, there may be a whole lot of other socioeconomic issues going on that drive these rates. However, the baseline reality is in New Zealand, type 2 diabetes rates for Māori and Pacific are 2 to 3 times European. And that is the baseline.
Thank you for answering my extra question there. I do really appreciate that. So I guess the next question is, how do we change this? And what are your aspirations for New Zealand?
Look, I mean, my aspirations for New Zealand that every person with diabetes, whether it be type 1 or type 2, gets actually appropriate support in the community. That's both medical expertise, allied health expertise, whether that be dietitian, podiatry, psychology, and community support. Kaifina, community. So I think, if we are to actually sort of start to really get on top of diabetes in New Zealand, we need to think about where we have real issues with diabetes and what parts of the country, how we resource those communities, both in terms of medical service, health services, and community action services to provide those wraparound support that people with diabetes needs. Because what we do know, it's not just medical. It's not just the medication that is important, although that is actually very, very important in treating diabetes. It's actually things like diet and exercise and those that daily activities and approaches you take to diabetes, and often that needs community support. So what I'd really, really like to see is I suppose a lot more effort going into those areas where diabetes is a real issue, where we can really drive community support so the community starts to take responsibility for what's going on with diabetes, and we adequately resource both allied health professionals and medical services to deliver the care that's really, really required to actually provide that support for someone who is living with diabetes and moving forward with diabetes. So there's a lot of work to be done, really important work, and we need to move down this track.
I totally agree. Coming from the family history I have, come from a Māori family, and the type 2 diabetes runs right throughout my entire family. I think the importance of the influence of whānau support is massive. Re-education within our whānau and within our community, I think is key critical to part of that, because then hopefully we can relieve a little bit of the impact on the health system. Would that be fair? If we're all moving in the right direction?
100%. And even in Pararua now, where I am, and what we've seen is these community action things been in place, like groups getting together and looking at growing vegetables at home or how to do that, healthy cooking classes, exercise class. Our Pararua Union, where I work, we now run regular walking classes with groups of men and women who have type 2 diabetes. And these things are really supportive. It's community, it's getting together, it's doing these activities and making them part of daily living. And that is so, so important, because obviously what we often see is diabetes is just not about the person themselves living with diabetes. It's about the whānau, it's about the family, and it's about that community support and understanding that sits around that person that is so, so important.
Totally agree. They call that the circle of care, right?
Yeah.
And we are going to be diving more into that topic as well. So, Brian, I want to ask you, how does New Zealand rate internationally on the incidence and outcomes for people with diabetes?
Look, I mean, I've tapped into some of these figures. So about 4 to 5% of the adult population in New Zealand has diabetes. About 280,000 people across New Zealand have diabetes. So it is a large, large issue. Our rates are less than some overseas jurisdictions, such as China, which has very, very high rates in the adult population. However, what we are seeing in New Zealand, what is actually really, really important to understand, we're now in the top 3 worldwide for obesity. And we know that obesity is directly related to type 2 diabetes in particular. So the rates are going up because our obesity rates are going up. So that's actually very, very important. But what we're seeing within the numbers within New Zealand, which is very contextual to New Zealand, is those much higher rates of type 2 diabetes, especially in Māori and Pacific, running about 2 to 3 times European, which is really significant. And the other thing we're seeing is what I call the left shift. So this is younger people, maybe in their 20s and 30s, and this is something I commonly now see in Cannons Creek. So younger 20s to 30s, often Māori or Pacific, who are being diagnosed with type 2 diabetes. Often we see it running in the family. There's some other social factors that come into play, but this very, very significant left shift where it's happening younger. And our youngest patient at our practice now is 18 with type 2 diabetes. And what we know is if you are younger, control tends to be not as good, and you tend to run into complication a lot earlier. And that's really problematic. So look, our outcome data isn't great, I've got to say, in terms of end-stage renal disease, heart disease, stroke, all those things we associate with diabetes. No, we're not doing that well, I've got to say, and it's a sad indictment perhaps on our system or where we're at the moment, and it's something we need to get on top of.
I totally agree, absolutely. Would you, again, Brian, I'm going a little bit off script again today, but I have to ask this question. Would you, with the people that you're seeing coming into the clinic, are some of them, I know from my own experience, people understand, yes, you can have diabetes and you can take medication for it, but are they sometimes forgetting about those complications that can ensue with this condition?
Yeah, look, I think the problem is, often when you're diagnosed with diabetes early on, it may not be impacting on you that greatly. You may feel relatively okay. You may feel good, and you may slip into the slight trap that occurs that I may have been put on some medication, and the medication may do the job. It'll protect me. It'll stop the diabetes, and it's very, very important, and I won't get complications. However, often what I see is people lose sight of the basics, like doing a bit of exercise every day to burn up that sugar, or watching our diet so we're not taking as much glucose or sugar or carbohydrate on board, which sort of overwhelms the body with glucose and sugar, which causes the damage. That those lifestyle issues of diet and exercise really underpin everything we do. So often, we see people losing track of those basics, which are actually a daily investment in your health, and losing track of the sight that, look, 10, 20, 25 years down the track, it may not be affecting you now, but that's often where the complications really start to kick in. Those complications we see, which could be vision, that is eyes, it could be the heart, and heart attacks and heart failure and these things, could be a stroke, or it could be kidney damage or kidney failure. Now, these are really, really serious complications. They're a direct effect of the diabetes, but they actually take years to really start to come into play often. So early on, it's often very hard to visualize what we're doing in terms of our health and what we're doing to protect ourselves against these things happening at the end of the day. And what we know is we can delay complication, we can reverse the effects of diabetes if we put in play those basics around diet, around exercise, and around taking medication appropriately, regularly, which is really, really important. So it's a combination of things that's so important.
Totally agree. And in fact, that leads us into the next question, which is it true diabetes is a condition that requires a lot of self-management. What's involved in that? And you've just basically covered that. It's about making conscious choices for your well-being, right?
I've always felt what's really interesting about diabetes, if someone comes to see me as their GP for their diabetes, they may be in the room with me for 15 or 30 minutes, once every 6 months, once a year. Okay, you may get to see me for 15 minutes, 30 minutes, an hour, over a year. The rest of the time, they're by themselves with their whānau and family, with their community. And so the management of diabetes and looking after yourself with diabetes is actually about the person themselves and what they do outside of the doctor's office, what they do outside of visiting the nurse, what they do outside of seeing the dietitian or podiatrist or whoever that happens to be. And that's the majority of a person's daily living. So yes, the answer to this is yes, that self-responsibility, managing itself, just getting, I suppose, working with diabetes and getting those basic lifestyle, dietary management steps into play is actually about self-responsibility. It's about the person themselves, because you don't have a doctor or nurse with you 24 hours a day, 7 days a week. It doesn't work like that. So it's my role in working with my patients who come to see me living with diabetes is to provide support and actually to hopefully provide some guidance so that the person can manage their diabetes when they're not in the room with me. And that's what it's all about.
That's fantastic, Brian. Brilliant. Absolutely brilliant. Now, one of the questions that I've got here is talking about what can happen to people who don't manage their blood glucose levels, that it's not well controlled, what can happen over time. And you've sort of highlighted some of those complications that can occur. I want to jump forward and just ask you, instead of, because we've already covered some of that, what can someone with diabetes do to prevent some of those complications actually from happening? And we've kind of touched on this, but just to finish up this section, if you can just remind us what are those most important steps we can take to help with, to prevent those complications from happening.
Okay, so there's really two clusters of things. One is to control the sugars. Because remember what diabetes is, whether it's type 1 or type 2, your body's sort of lost the ability to keep sugar levels or glucose levels in your blood under control. So they tend to go high. That's what tends to happen. Now, unfortunately, sugars that are high in the bloodstream over time start to do damage. Okay, and they can start to do damage to the eyes, they can start to do damage to the heart and the circulation within the body, and they can start to do damage to the kidneys in particular. So we need to avoid that, and we need to bring the sugars down and control the sugars. So to do that, the critical points are, number one, diet, number two, exercise and increasing your level of activity, and number three, medication. So that's really, really important. However, the other big cluster of things that we really want to protect against are those cardiovascular events like heart attacks, heart failure, and strokes, which we know have a markedly increased risk with diabetes over time. So it's often important to control our blood pressure, to control our cholesterol levels as well, so that those fats and things don't clog up the heart, and to keep those things under control. So blood pressure, cholesterol is also very, very important. The third thing I'd say that is important is those routine checks that we ask people living with diabetes to go through. Now, they are things like retinopathy checks on the back of the eyes that are done once every 3 years to pick up any changes in the eyes due to diabetes, so something can be done about it early. 2, checking the kidneys. We often do urine checks once a year. They're really important to pick up any early changes to the kidney so we can do things to actually prevent any damage to the kidney, which is really, really important. And things like routine foot checks to check the circulation and make sure that our circulation to our feet, because that we know that ulcerations and problems with the feet can start to develop over time, is really important. So really controlling the sugars, diet, exercise, and medication, watching our risk factors for cardiovascular disease, which is, cholesterol and blood pressure is really, really important. and those preventative checks that are so important. Our eye checks once every 3 years, seeing the podiatrist every now and then to check our feet and make sure our circulation's okay. And the other thing I'd add to that is things like immunisations for things like flu and COVID are so important, because we know the outcomes from flu and COVID are worse if you've got diabetes. So those sort of preventative issues are really important. The final thing I am going to say is smoking and diabetes don't go together. So smoking or reducing smoking or stop smoking becomes another thing. So look, there's a range of things that start to come into play that are really important on a daily basis. And those are some of the things that we start to think about and to work with over time, because everything doesn't happen at once. It actually happens over time.
Totally agree. And I just wanted to double check. I know that there's been a focus of the chat so far about people living with type 2 diabetes. Are those same tips relevant for people living with type 1 as well?
Well, type 1 is incredibly important. It often doesn't get the airtime of type 2 because of the numbers, but it's incredibly important. It happens for different reasons. Obviously, insulin is a very, very large part of type 1 management, and Liz might want to start to tap into this a bit. But yeah, look, those basics are still incredibly important. Diet, exercise, and medication. And obviously, insulin is a very, very important part of the management of type 1 diabetes, and how we approach certain aspects of what actually goes along, in particular, low sugars. What happens if sugars go very high in ketoacidosis? There's a number of very technical things that occur, but those basics are so important as well. So they're still in play.
Excellent. Brian, thank you so much. Really value the opportunity to carve up your brain a little bit more and ask those extra questions. I know our listeners and our viewers will love that information as well. So thanks, Brian. I'll be coming back to you very shortly with some more questions too. Now, Liz, thank you for waiting so patiently. I've got some great questions here for you as well. First of all, Liz, from your area of expertise, how important is it to have the support of friends and whānau when you're living with diabetes?
Well, it's essential to have friends and whānau supporting you in your journey of diabetes. If they are not supporting you, you feel very alone. You have no one to talk to about your experiences. Also, the day-to-day living, if you're trying to lead a healthy lifestyle, then you want people around you to be eating the same things you are. So for the whole whānau to be eating healthily is going to have a huge knock-on effect, not just for you, but also for the rest of the whānau. So there are times when people with diabetes can be challenged by their whānau tempting them with poor food choices. By buying healthy food simply will help the person with diabetes. The other thing about whānau is that if they're a blood relative, like a parent or a daughter or son, they may have diabetes themselves, or they may get diabetes with not living a healthy lifestyle. Also doing physical activity. So if you can do it together with other people, then you are better motivated to do it.
So the importance of a healthy family plan is key critical for someone living with diabetes. Is that what you mean?
Absolutely. So doing it together, it kind of halves the challenges, really.
Yes.
And if other members of the family can't exercise, then at least they could encourage you to do it and help you to find a time to do it to support you.
Totally agree. So my next question to you, because I know you are the woman with the hands-on experience, what advice would you give someone with diabetes in their family? Great question.
Well, I think it all comes down to that healthy lifestyle Brian was talking about earlier on. So eating less things with sugar in, reducing the amount of carbohydrates that you eat, and eating more of those healthy coloured vegetables. Getting annual screening tests, because if your parents has type 2 diabetes, you're at a much greater risk of getting it yourself. So by getting an annual screening test for diabetes means that if you do go on to getting it yourself, then it will be picked up much earlier and you have a better chance of being able to reverse it. So also being alert to the signs of diabetes. So feeling tired, drinking lots, and going to the toilet frequently, and also going to the toilet a lot overnight, for example. They're all things that are signs of diabetes. So if you're alert to that, then you can go and get a screening test for diabetes. The other thing is that on our website, we have a Know Your Risk test. So if you go to www.diabetes.org.nz and go to the section that says what is diabetes, you will find under there the test Know Your Risk. And if you answer all the questions, then you will see what your current risk is.
Fantastic. Thank you so much for that. Now, I want to ask you a bit of a question, which is slightly off script again, because that's how I roll. I love to have these chats with people. If you notice someone in your family displaying those symptoms, and Brian, I want to open this question up to you as well. If you see somebody, how do you open up that conversation with them? Liz, let's start with you.
It's a difficult one because a lot of people are aware that they are at risk of getting diabetes, but they don't actually want to know that. So to open up the conversation is a challenge. But I think for their sake, you would want to be perhaps pointing out what the symptoms they are displaying, and then ask them if they would mind you going with them to see the doctor and to get a screening test asked. So getting the screening test is really important.
Totally agree. And Brian, what would be your thoughts? I mean, you're dealing with these communities which have higher risks, obviously. Are you seeing these conversations? Are you seeing people bringing in their family members to get screened? How, specifically for Māori Pacifica, what would you recommend to open up that conversation?
Look, I mean, I think there's a couple of important things that have been tapped into here. Often we do see diabetes running within families, and often there can be a degree of fear or anxiety about potentially developing diabetes and what that means. I suppose the thing to focus on is the fact that if we manage to diagnose it early, we can do something about it. We can prevent those complications occurring. So that's a really important thing to focus on. So look, I think I agree with Liz. I mean, if you notice someone in your family that you think would benefit from screening because of maybe symptoms or how they are, I think it's being honest and having a conversation. And it's actually sort of saying, look, it's a simple test. It's a simple blood test. It's just seeing your doctor or your nurse. And if there is an issue there, we can actually do something about it. And I think that thing about support or going with the person, it's something I see a lot of. Often a wife will come in, or a mother will come in, or a son will come in with their family member to sit down and chat and say, look, I'm concerned, could we do this? The other thing I'd say about this, certainly in the area that I work in, we've tried to make screening for sugar or diabetes or glucose just a routine part of what we do. So generally, if we order a blood test for something, if someone's seen us, we'll actually say to the person, we'll do a sugar test as well. And most people are very amenable to that. It's part of routine screening that we now do. And we've tried to really put it down and keep it sort of low stress, low anxiety. It's just part of what we do. And the reason we do that is because we can actually do something about it if we pick it up early rather than late.
So it's like the management of diabetes as well. It's about proactive management. And it's the same thing with a diagnosis, supporting your family, being proactive around their circle of care and well-being, being mindful of the symptoms we might see or the behaviours we might see, and then actually doing something about it. Is that what you I think that's where we've got to with that, right?
I think there's a really important point here that being proactive about screening and going ahead and getting blood tests for certain things. We do it for the prostate, we do it for cholesterol, we do it for blood pressure. Sugars should be just part of what we do for our health, for investing in our health, so that we're able to pick things up and deal with them early rather than late, because everything is treatable. We can reverse things, we can intervene. So I think just making it part and parcel of what we do is a really, really important point in all this.
Excellent. Now, Liz, a final question for you there. Is there anything else in the toolkit that someone with diabetes can consider to help themselves on their journey? What are your thoughts?
Sure. We talked, Brian talked in the first place a little bit about type 1 diabetes. And as he referred to, they have to take insulin to live. Now, one of the things that is in the toolkit for people with type 1 diabetes are insulin pumps. Now, insulin pumps take away the need for putting a needle in your tummy 4 or 5 times a day, or even more. So that does improve lifestyle tremendously. On top of that, you also have continuous blood glucose monitors and flash glucose monitors. They take away the need to prick your finger and get sore fingers. So for people, especially with type 1 diabetes, nowadays, the ability to be able to have an insulin pump that delivers insulin continuously, and have a continuous glucose meter that measures the blood glucose continuously, and then talk to each other, enables a person with type 1 diabetes to actually live a much more normal life. Now, for people with type 1 diabetes, many of these continuous blood glucose monitors are not funded. And, well, the pumps are funded for many, but continuous blood glucose monitors are not funded for anyone. And obviously, in New Zealand, that means that people with diabetes or type 1 diabetes do not have the ability to be able to lead a normal life. Now, there is the potential for people who are beneficiaries to go to WINS and negotiate for the possibility of getting assistance with obtaining a continuous glucose meter. So they are other things in toolkit.
Excellent. Excellent. And hopefully moving forward, if we get the message out there enough, hopefully the government will start listening and start to support people with diabetes. I mean, I don't have to get either of you on the soapbox talking about that, because I know you're both fighting the good fight every day to help people get access to the vital tools needed to live, as you said, Liz, a normal life. So thank you for that. Brian,
can I just make a comment, running on from Liz and what she was talking about with the continuous glucose monitoring and things? Actually, if we look at type 2 diabetes, we've now got a range of medication available to us that we never had 2 years ago, 3 years ago. So these are things, Trulicity or diglutide, which is a once-weekly injection, empagliflozin, which, as well as treating diabetes, protects the kidneys, protects the heart, the gliptins, which don't cause hypoglycemia. So we've got a range of medications that we didn't have available previously, which has opened up the way we approach, in particular, type 2 diabetes. So one of the things I'd say about our thinking on this, screening, establishing if there is a sugar problem. Look, there are a range of treatment options when I talk about medication and things that are available to us that weren't there now, that are very good, that protect the heart, can protect the kidneys, that we can get access to early rather than late. And that's really, really important in the context of the treatment of diabetes and where we're at this point. So I think, these developments and what's actually occurring in terms of our modalities and our medications and our things like continuous glucose monitoring and things that we're starting to get access to are really, really important in how we approach diabetes and how we treat it going forward in terms of the medications and the types of insulin, the types of delivery mechanisms we've got, which is, again, another reason for knowing about things early so we can start to look at the options early rather than late.
Excellent. I'm totally with you on that one. Now, final couple of quick questions, because I know you're both incredibly busy doing this wonderful work you're both doing out there in the community. We mentioned the term circle of care. So in just very, very short answers, because I know that's a whole nother episode of its own. But can you tell us who you each believe sits around a person with diabetes to provide diabetes care and assistance? What should a person with diabetes have as their circle of care? Brian,
I would always say,
Liz, go.
The first and most important one is supportive whānau and friends. And then, of course, you have Brian, your local GP and practice nurse. Now, I'm sure, as Brian was talking earlier on about all the other specialists that get involved, optometrist is really important to do your retinal screening. And there's a whole long list: dietitian, podiatrist, specialist nurse, endocrinologist. And then you've got all the specialists in all the other departments, like the cardiac clinic renal clinic, vascular clinic. And funny enough, when I was really thinking about this just now, I thought, what about the phlebotomist? Those people who take the blood out your arm and the people in the laboratory that actually test it.
Wow.
And you can't forget the community pharmacists are great. They're the people who hand you your medication, and they're the people who know what they do and what their side effects are. And if they were there, they're always there to answer your questions. So that was me taking over.
That's great. Brian, anything to add there?
Look, I think Liz has covered it really well. However, I would add one thing, that I think what is actually really, really important, and I agree with everything Liz has said about whānau family, the range of services that are available. When it comes to care in the community, your general practice or your medical centre with your GP and your nurse are critically important. And I'd go one step further, that I'd say getting a relationship or seeing the same person over time is really, really important, I think, for good quality care. Someone who gets to know you, gets to understand your diabetes, gets to understand your issues and how to put in support. So I think that continuity aspect, either with your local medical centre, your GP, your general practitioner, or your nurse within the practice, is a critical element to care going forward.
Absolutely. And it says on my notes here, it says, finally, what are the regular health checks someone with diabetes needs to do to stay well and on track? And we've kind of highlighted this right throughout the entire chat today. So any final tips or takeaways that you'd love anybody listening or watching to take on board today? Brian, I'll start with you.
Oh, look, I mean, living with diabetes, again, it's about lifestyle. It's what you do. Look, there is a requirement, not a requirement, but look, there is this preventative screening, which is really, really important. Things like the eye screening, the retinal screening, the podiatrist, the checking the feet, those either 3 monthly, 6 monthly, or yearly blood tests, which is so important to look at cholesterol and sugar levels and check we're on track. And those basics like just measuring blood pressure, making sure it's all okay, and checking the urine every now and then to make sure that the kidneys are working okay. Because if we pick up things early, and this is the key message I want to probably get across there, if we pick up things early, we can actually do something about preventing damage and the consequence of diabetes. So that early intervention, early diagnosis, getting in early is really, really important. So for me, that's probably the key message.
Absolutely brilliant, Brian. And Liz, final word from you. What do you want people to take away from today's chat?
I want people to remember what supports they have at home, in the community, and also remembering that your GP and practice nurse, I agree with Brian, should always be your first port of call.
Excellent.
If you have any problems.
Absolutely brilliant. Well, look, thank you so much, Brian and Liz, for sharing time and space with me in today's podcast. I've really valued both of your wisdom, and thank you so much for the great work that you're doing to support people living with diabetes in New Zealand. Not just the hands-on work, but the advocacy level work that you're doing. You're both fighting the good fight every day. So thank you so much to both of you for joining me.
Thank you.
Thank you.
So thank you to our guests today for sharing their expertise. And if you'd like to hear any of the podcasts in the Diabetes Matters series, or to find out more information about diabetes, make sure you go to www.diabetesactionmonth.org.nz. I'm Monique Bradley. Thanks for listening or watching. Ka kite anō e noho rā.